Hey everybody, it's Alicia Reiser from A Rise Above Occupational Therapy, and today we're going to talk about what an OT vision room actually looks like, whether you're a treating therapist or a patient who needs to work on their vision. It may contain such items as zip code lists, number charts, letter charts with underlined letters, small and short words, heart charts, and scanning boards like the one created here. Or it may just have something as simple as a pantry where you work on scanning and looking for items. Here we have word circles, a laser pointer, a near point rule, an acuity chart, the multi-matrix, and a tracking tube. All of these items can be used for either assessment or for treatment. The near point rule will give you measurements when you're checking for convergence and accommodation. The tracking tube, as shown in other videos, is used for treating pursuits. You may use this in combination with your zip code charts, your letter charts, or your number charts so that the client can work on looking from near to far, simulating board to table, and working on cognition at the same time. Within the room, you may also find lots of games. Dice games, card games, your own Find It bottle that you've created. You can use Spot It on the wall. You can use a scanning board with categories. You can place the game set on the wall where you're matching, and you can even use simple flashcards, again, to involve a cognitive load. For assessments, you may find the VMI, the DTVP, or the MVPT. If you're working on paper tasks or visual motor integration and handwriting tasks, you might have a binder that looks like this. There might be cancellations within them. There might be line tangles. There might be word searches and mazes, all of which are working on saccades and figure ground and visual motor integration with handwriting. You might have maps. There may be functional tasks where you're tracing over lines or shapes, and then using those to cut out so that you're working on visual motor integration. You might have the Ann Arbor pages, which work on saccades and sequential organization and cognition. You may also have some visual information processing worksheets that look on visual closure or pattern recognition. Because we're working on functional vision, I like to use these free magazines that come in the mail, or you can use a menu and use it for saccades and figure ground and cognition as well. Here we have a simulated light board, and we're using a laser pointer to jump from wormhole to wormhole, otherwise known as dot to dot, working on visual motor integration. We then tried to weave the laser pointer in between the dots without hitting the circles. Again, working on pursuits and saccades. Here we're also working on pursuits. You can easily do this with a record player, and you can scan for sequencing of your letters as the record player turns. You can also make a marble tunnel, again sequencing letters, following the marble through the tunnels, working on eye-hand coordination in order to make the marble go where you want it to. A definite necessity to have within an OT vision clinic is laser pointers. If you have two different colors, you can play fun games like flashlight tag and follow the leader. Your OT vision room can have balls with different patterns and colors and cups, and then you can work on pursuits in a fun and entertaining way where you're working on visual motor integration, again in pursuits. And all you need here, like I said, is a couple of different ball colors and patterns and 2 cups. Zoom balls in the clinic are always a fun way to work on visual pursuits and bilateral coordination. You can create your own Find It jar, which works on visual information processing, figure ground, visual closure, form constancy. It's nice to have in your clinic a category board where you can work on color identification, categorization, using the laser pointer to follow for saccades and near-far work. Remember that everything we do involves some sort of visual skill. So using games like Tricky Fingers, Rush Hour, Battleship, Parquetry Blocks, Spot It, Simon, Rubik's Racer, all of those games involve some sort of visual skill. Sorry Sliders involves pursuits. Simon is also fun to have in the clinic to also work on pursuits and visual motor integration. The game Multi-Matrix also is fun and a must-have to have in your OT vision clinic because it works on so many different aspects, not only for vision, but for cognition, working memory, crossing midline and sequencing, using both shapes and patterns and numbers and letters. It's also nice to have bananagrams or letter tiles in your clinic because you can work on saccades and visual memory with spelling with the tiles. You can work on figure ground, pattern recognition, where you're pulling out all of the same letters and then looking at pulling out the same pattern of letters, either be a solid, a stripe, or a polka dot, for whatever skill you want to work on. I wanted to take a moment and talk about the Brock string in terms of both function and when it's appropriate to use. The Brock string is an optometric intervention that can be used. However, it should be used with caution because it can develop a splinter skill that then makes it more difficult for optometry to make an accurate diagnosis. It is a technique that can develop the kinesthetic awareness of vergence. However, you must be certain that there is a diagnosis for the same condition. I hope this has given you some ideas of what to expect if you are receiving occupational therapy for some visual issues that you're having impairing your function, or if you're an occupational therapist that is looking to establish some functional tasks when vision is impaired. If you or someone you know is having visual difficulties, either from a traumatic brain injury, concussion, or from a developmental delay, reach out to Arise Above. Find us on Facebook. Check out our website at www.ariseaboveoccupationaltherapyservices.com or continue to subscribe to our YouTube channel. And always remember that OT can help.